Endometriosis could be on the ovary, like I mentioned earlier. I showed you that picture earlier with that endometriosis on the ovary. When you have it on the ovary, it's called an endometrioma, which is an ovarian cyst, but it's a form of an ovarian cyst.
Right.
There's so many other types of ovarian cysts. There could be functional ovarian cyst, corpus luteum cyst. There could be, pathological ovarian cyst, which could be from an infection, from TB. There could be cancerous ovarian cyst, which could be from, obviously from cancer, or just normal benign growth. So ovarian cyst is such a broad term. And I think for most young people, the commonest one are like functional corpus luteum cysts that could complicate and all that. But endometrioma is a specific type of ovarian cyst, which is endometriosis on the ovary. I hope that makes it clear.
It does, to an extent. All right, so Temitope, we'll take your question, please. Make it as short as possible. Thank you.
Can you hear me now?
Awesome. Yes, we can hear you now. Please carry on.
Okay, I'm so sorry. I had to remove my earpiece because I guess you guys weren't hearing me. Okay, I had a very, very late diagnosis of endometriosis. Right now, I'm 42. I wasn't diagnosed until I was 39. And I'm tired. I'm really, really tired. I've been through a lot. There is nothing I've not done before I was actually diagnosed. But right now, until I found a gynae who is a specialist in endometriosis, and he had advised me for a surgery because I have the umbilical endometriosis. So, and he's telling me that, okay, probably if I remove the endometriosis, the umbilical endometriosis, and also he found little fibroid in my uterus, I'll be able to conceive, which I've done fibroid surgery before now. So I just want to know if it's possible, though I believe God, there's nothing God cannot do. I believe in God and all that. But, there are times that you really, really get tired. And I just want to know if it's possible, or I should just try surrogacy, or I don't think I even want to go through another round of IVF again. I don't know. Thank you.
Doctor, did you get that?
I did. Always difficult to make a call when you're not seeing the patient. But a couple of things. At 42, the ovarian reserve is not what it was. So already at 42, the chances of conceiving with IVF is already quite slim, with or without endometriosis. It's slimmer than it was at 35 or 20 or 32. And those are the figures that need to be discussed already, beforehand. So 42 already brings your chances of conceiving with IVF lower. It's not zero, but it's there. Endometriosis obviously contributes to bringing that figure down a little bit lower. Just to mention, the umbilical endometriosis has nothing to do with your fertility. That's extra pelvic. It's not in the pelvis, it's in the umbilicus. The treatment often could be medical or surgical. Usually surgical, we can remove that. But doing that does not affect your chances of conceiving. So you need to understand that. Okay. And the fibroids that have been described are probably not, I haven't seen the scan, but it depends on where the fibroids are. We don't remove every fibroid, as far as fertility is concerned. To be honest with you, the chances, 42 late diagnosis, been trying to conceive several IVF cycles. Your best bet is probably egg donation. If your uterus is fine and the cavity is fine, it's not surrogacy, it's egg donation. And egg donation is a very sort of well utilized, form of ART, and we use it very, very much, very often. So it's like young anonymous donors who you don't know donate eggs, and those eggs are available. Those eggs are then used to fertilize, or to be fertilized with your partner's sperm, and those embryos are then put in the uterus. So that's probably the way to go, with that kind of situation.
So, Doctor, just before we go to, from Temitope's question, does this mean that one can have adenomyosis and fibroids at the same time?
You can. Oh, yeah. In fact, to be honest, I think you're probably looking at about between 20 and 30% of patients with fibroids have adenomyosis as well. So you can have a combination of them. Adenomyosis and fibroids. So you could have a double one.
Thank you.
Everyone. Good evening, Doctor.
Good evening.
Okay, I'm 25 years old. My name is Susan. I was diagnosed of adenomyosis last year.
24.
My question is, this adenomyosis, I've been noticing some discharge for some time now. Watery, foul-smelling discharge. Does adenomyosis come with watery, foul-smelling discharge?
Sure. Again, difficult to sort of make a call based on not seeing the patient and all that.
Yeah.
But it's not one of the commonest symptoms of adenomyosis. What you do have with adenomyosis is spotting in between. So in other words, you can have a period and then in between you might have a bit of spotting. Some of those, especially if the adenomyosis, if the endometrial tissue that I mentioned is close to the cavity. So you might actually have that. It's quite possible that you can have, if that's ongoing and it keeps secreting during the month, you can have a brownish discharge or a bloody discharge, and when that sits in the vagina before it comes out, it could get infected and you could have a foul-smelling discharge, like I described it. So it's difficult to be absolutely certain that that's the reason why you've got it, that discharge, but it's a rare cause of that kind of discharge. There are other commoner causes of a foul-smelling discharge which one could explore. So you probably do need to see someone have it treated or have a hysteroscopy done to try and see if there's another reason why that discharge is happening.
All right, I think Ayorinde is back now. Ayorinde, are you there? Can we take your question now? Or do we carry on? So while we try to get Ayorinde to ask his question, I also wanted to find out, speaking about fertility, is it possible for someone with endometriosis, not adenomyosis now, because adenomyosis seems to be a bit more severe compared to endo. Is it possible for someone with endometriosis to have a successful IVF after undergoing a laparoscopic surgery?
All the time. That's actually the normal route of things, to be honest with you. If you have a proper laparoscopy done and endometriosis is excised and removed, if it's stage 3 to 4 disease, like I mentioned in the presentation, the treatment is usually IVF. So we go straight from surgery straight to IVF, and a lot of times, you get successful pregnancies that way.
All right, thank you. Neki, can we please take your question?
Okay, good evening. Good evening, everyone.
Good evening.
Sorry, I just want to share, it's a question, but it's pertaining towards me, I feel. I've been battling with this stuff for over 9 years now. And, I always have a severe pain before periods. Then when my period comes, there was a time it was heavy. And then I have pain during ovulation. But after ovulation, I don't have those pains till when I want to start seeing my period. So I have to go to the hospital for a scan, and they said I have adenomyosis. But as at 2021, I went for a Zoladex injection. I took for 3 months. So after that, the pain subsided and a lot of changes was there. But recently I noticed, last year also I went for IUI and the IUI failed. But with these symptoms that I see the doctor talking about, I noticed that some of those symptoms I don't have it, like having pains during sexual intercourse. I don't have that. And the pains I normally have is just during periods. And that period, once it's the 4th day of my period, I stop feeling those pains. Then it will just give me a gap of 4 to 5 days. When I'm about to ovulate, that is when I'll start feeling that pain till after ovulation. So what I want to ask now is that, will I say that this is also adenomyosis or endometriosis? And is there any possible way I can go without doing a surgery to get pregnant? Thank you.
Thank you, Neki.
Yeah, good question. I mean, I think so. The presentation was trying to cover what the potential presentations could be with patients with those conditions. So, in other words, not everybody that has endometriosis will have all that list of symptoms that I mentioned. Not everybody that has adenomyosis will have all those list of symptoms that I mentioned. You might have one, you might not have any. In fact, remember I mentioned at the beginning that some patients with adenomyosis have no symptoms at all. but you can't have any of those extensive sort of symptom lists that I had mentioned. So it's still very possible that, with what she described, that you do have adenomyosis. Probably even likely that you do have adenomyosis or endometriosis. Obviously, like I said, the diagnosis will have to be made by somebody who's got the experience of doing that. Pregnancy is always possible, especially if you're young enough, but you probably need your eye doesn't work so well for adenomyosis. You're probably looking at IVF, to be honest. IVF, and like I mentioned, perhaps with frozen embryos, and then an embryo transfer after there's been suppression of the adenomyosis. So that would be my approach. IUI would not be the way to go because of those issues that I mentioned with implantation failure and inability to conceive based on that. So you're probably looking at IVF with frozen embryos to try and get pregnant.
While we're on the topic, we have another question here from the support group on the success rate of IVF for individuals with endo. What is the success rate?
So it's probably at par or probably slightly lower if you do it with the laboratory that is good. Probably slightly lower than what you have with patients that do not have endometriosis. So it's not, so it's not significantly lower. It is lower. So the number of eggs you retrieve in most of the cycles, the number of eggs we retrieve and the number of embryos you form is lower compared to patients who do not have endometriosis, but the pregnancy rate is actually not that much lower in that group of patients. So it's still the way to go. Patients who have severe endometriosis, in a good laboratory, the chance. So the most important thing about this is the age, and I think I mentioned that earlier. The younger you are when you do IVF, the better your chances of success.
Sorry, I do ask a lot of questions about this because it's what I've been experiencing.
And it's the right thing, really, to ask questions.
Because even within my friends, and although I have a friend that she had fibroid surgery that was 2 years ago. So after that, she's having severe pains. Every month they will have to rush her to the hospital for heavy painkillers. So that's where I get to know that this adenomyosis and endometriosis it's like they have same symptoms with that of fibroid. So I always advise her to go and do that. Then, doctor, what I want to ask also is, please, is there any particular painkiller or that one can take? Because I won't lie, I've been on painkiller for over 9 years. It's like on a daily basis I'm on painkiller. All my handbags and my rooms, I do buy painkillers and put inside so that I won't forget. Even at my office, there is painkiller in my drawer. So I don't know if there is.
Doctor, can you make any recommendation?
It's a tough place to be honest with you, Nikki. I mean, the reality is that the painkillers are painkillers. That's what they do. They take the pain away for that period of time, and then once that time is gone, the pain sort of recurs. So you've not dealt with the root of the problem. So you need to tackle from what I'm hearing. You're trying to get pregnant, so the chances are that we can't put you on hormonal suppression because that will prevent you from getting pregnant. So it's a rock and a hard place. If IVF was something you can afford, I would say go there. I could tell you names of different painkillers, but they will do exactly the same. They're not going to take the pain away completely. They will just control the pain for that period of time, and they will come back again. So you need to get to the root of the problem. Are we dealing with fertility? If we are, perhaps do IVF the way I've discussed it. Otherwise, if we're dealing with pain, you need to go on some kind of suppression, either with progestogens or with Mirena or something that would try and help in the background. And like I said to you, a lot of patients actually have to go a multidisciplinary approach. So we get psychologists involved, we get psychiatrists involved, pelvic floor therapists. There's so many people so there's a multidisciplinary approach to this, and it's not just about the painkillers or the treatment.
All right. I don't know if Ayorinde is
Thank
back.
you.
Hello, good evening.
Good evening.
Yeah. Good evening, doctor.
Good evening.
Thank you. Yeah, sorry, I missed a little because I actually just stepped in to go and pray to break my fast, so I just came back. I don't know. I missed the part of the IVF. I don't know if it's possible for IVF with 2 bad tubes. I've had my 4th surgery. My 4th surgery was in July last year. for cysts and fibroids, with my organs joined together up to the bowel and the intestine. So I don't know. The fourth surgery I had, this was discovered that my
I'm not sure Aisha is probably something with her internet, but doctor, I think you have enough information to answer.
Yeah, I suppose. Yeah, I mean, multiple surgeries, maybe for fibroids and perhaps for endometriosis as well. The problem is that, often with multiple surgeries in the pelvis, the tubes are damaged, often because of previous infection or just because of the surgeries. And the treatment for that is IVF. So IVF is what we do to treat tubal disease or tubal factor. But the problem is that when you do IVF, you put the embryos back in the uterus. So if the uterus, the womb, which is where the fibroids are, have been operated on so many times, the chances or the ability for the uterus to, take in that implanted or transferred embryo is then affected. So that might be the problem. So it's difficult for me to make a call based on what I've heard, because I haven't seen her and examined her and checked what the history is. But often it's not just about the tube. The tubes, the treatment will be IVF, but IVF might have a problem if we don't have a uterus that is normal because of so many surgeries that she's had.
All right, thank you, Dr. Sarah. Can we take your question? This will be the last question for the day.
Okay, good evening, everyone.
Good
Very
evening.
insightful session, I must say. Thank you, Doc. So, my question is pretty simple. I just want to know, because I've heard some women say here now that at 25 they had adenomyosis. So, is it possible for adenomyosis to affect younger women?
Yeah, the short answer is yes. That's unfortunately what used to happen in years gone by is that adenomyosis, when I was in medical school so many years ago, that, we made a diagnosis of adenomyosis when you did the hysterectomy. So you take the uterus out and then you look at it and say, oh, shucks, there's adenomyosis there. But in the last sort of 20, 30 years, there's been a lot of, with the advancement of MRI and ultrasound scan, you can actually make the diagnosis. And we're teaching the doctors to learn how to identify it, because it's often missed. So it is very possible that you have it even in some teenage women, maybe mild disease, or you can have adenomyosis in women as young as 18, 19, 20, and then right across. So it's, like I said, in those days, we used to be taught adenomyosis only happened in older women who've had kids, and it was just easy because in those women, it was easy just to hysterectomy and you kill them, and then you find the adenomyosis afterwards. But actually, more and more, we're beginning to realize that you can actually find it in younger women as well.
Dimple is here and she has a question.
Yes,
I was going to actually come to you before we wrap this up, so I'm glad that you're here now. Please carry on.
Thank you, Doctor. I want to find out, we have a lot of women now that present with umbilical endometriosis. So I don't know if there is if they undergo surgery, if it takes it away completely. And do they have chances for a successful IVF?
Oh, yeah, absolutely. So, like I mentioned earlier, umbilical endometriosis is umbilical. It's outside, it's on the abdominal wall. It is annoying because you bleed from there every month and it soils the clothing and it's painful and all that. The treatment is usually surgery. So it's a matter of it, but you have to excise it completely. So in other words, most of the time we have to remove the whole umbilical, the whole nerve has to be removed, and then you suture that. That's usually curative. So in other words, you can do surgery, but it doesn't affect their chances of IVF. It has nothing to do with IVF chances. It has nothing to do with what's going on in the pelvis. It's an abdominal wall condition, and you deal with it. You can also treat it medically. In other words, you can't give Zoladex that have been mentioned or progestogens and all that, but that will keep it suppressed. It doesn't take it away, but it will suppress that. It would also suppress the ability for them to conceive. So in a patient who's trying to conceive, and is bordered by umbilical endometriosis, you're probably looking at surgery to remove the umbilical endometriosis. And then you can, most of the time when you have umbilical endometriosis, you have pelvic endometriosis as well. So you can either, often we actually combine both. We remove the umbilical disease, and then we go into the pelvis and remove the disease as well. And then treatment from there and then depends on how much you found, what the age of the patient is, and then you start thinking about things like IVF from there.
Wow, thank you so much, Doctor. This has been really, really insightful. And I know that if we left the floor open, more and more questions would keep coming, but we are trying to stick to, the time that we allotted for this. It's integrity on our part. And also, of course, the fact that there are more questions that people want to ask and there's a lot more information that people want to have with regards to this means that we're doing something right. And so before I just close this out and let you know where next we will be taking this conversation, I would like for Bimpe to just, give a word of encouragement to women who are dealing with endometriosis and adenomyosis on how they can carry on with life and do the things that excite them, their ambitions, etc., even with these conditions.
Yes, thank you, Bella. I'll say that, I'll encourage women to, I'll use the word bravery. Yes, because I feel that, with endometriosis, it's like a road without, a return. You just have to face it.
Please highlight your video so that everyone can see your face.
Oh, okay. So I feel like it's like it's you're at a point where there's no return. I believe there's a return, with faith, in God. But what I mean by saying that is face it, try as much as possible not to dwell so much on it. Face it, deal with the symptoms, and with time, I believe it gets better. Even when the symptoms are there, by not dwelling so much on it, you kind of, I'm not saying get used to it, no, but you kind of deal with it in a better way. You kind of, you don't get psychologically drained, fall into depression, or become anxious, or get into some mental health issues because of it. So I think that was how I dealt with it. I had very severe symptoms. Mine was really bad. I had adenomyosis, and my doctor, he calls me his special patient because I'm always there, But, somehow I was able to, accept that it's there.
Yes.
Yes, like not fight it, because it will be like fighting oneself. That's how I can put it. You need not dwell on it. Yes, it's there. Face it and keep doing whatever you have to do. Don't let it stop you. My doctor encouraged me. I remember many a time he would encourage me about study and all of that, So, and I did. So, yes, it's there. It can, what other people do takes them 2 years or 3 years to do, might take you about 10 years. I mean, 10 years exactly. Let me say longer years.
For longer, yeah.
But you just need to keep doing what you have to do so that you can still achieve your dreams. You can still become that person you want to be. So my word of encouragement is that do not allow endometriosis stop you. Do not allow adenomyosis stop you. Do whatever you have to do. Consult your doctor regularly and take the next approach.
Amazing. Thank you so much. Thank you so much, Dr. Femi Olarugun, for your time today. I mean, if anyone came in here without any idea how to deal with this or how to spot endo and adenomyosis, I think that your presentation has made it so clear. And the answers you've given as well, very practical, also very encouraging, for people dealing with this. And of course, thank you also, Olabimpe Fakbonda-Dube, for putting this together. Bimpe is the convener of this Endo Talk, and she's also the founder of E&A Foundation. Like I mentioned earlier, there's a lot more questions to be asked. See the applause in the comments. Everyone is applauding. There's a lot more to talk about. I'm sure Doctor has a lot more to say, but time constraints, the fact that this is virtual as well, sort of restricts how much we can say about these issues. But I would say look forward to a lot more content that will be coming from the E&A Foundation. Follow on social media, on Instagram primarily, E&A Foundation, and of course check out the website as well for information. Binkme has some memos, very short content that she has put together, encouraging people on how they can live life and how they can carry on with whatever purpose they have, regardless of the conditions that they are dealing with. And I know that it's going to help you, it's going to encourage you really, really greatly. The doctor also is open to answering more questions. Doctor, can we have your social media handle or your email address? Where can we reach you?
I definitely don't do work on social media if I can help it, but
right.
but I'm reachable on email, and it's Rogunes, ROGUNES @gmail.com.
There you go.
If you Google Heart Fertility Cape Town, so HART Fertility in Cape Town, that's there's the secretaries and all that. There's a whole host of information you can get from there. Lovely. And it can be reached through there as well. Yeah.
Awesome. Thank you. There it is. Thank you. Yes. Thank you, Binkwe, for that. So check out the E&A Foundation website, eafoundation.ng. That is the website. Bookmark it. If you need more information, if you just need to go somewhere to figure out, what is going on, and if you need to explain what is going on with you to people, your community, your family members, people in your life, and help them understand that what you are dealing with is not the easiest thing. The website is a very good place to go, as well as the social media handles as well. Thank you guys so very much. My name is Belarus Duriji. This has been really exciting to do. We will be having stuff like this in the future. So it is important to follow on social media such that when the information about something that we're doing comes up, you are the first to know. All right. Thanks again. Have a beautiful evening, everyone.
It's a honor to have you.
Yeah. All right, everyone is sending me their picture.
Thank you so much.
Yes.
Absolute pleasure.
There you are. Look at your beautiful face. I love you guys so much. You have been really exciting. Spread the word about endo and adenomyosis and tell everyone who knows someone who's dealing with this to check out the eafoundation.ng website and follow on Instagram, E&A Foundation, for more information. We'll see you when next we have this, which hopefully is very soon. Good night, everybody.
Thank you. Bye.
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 Bye.